So let us summarize a case of retinitis pigmentosa. So a typical case of retinitis pigmentosa चाहिँ कस्तो हुन्छ त है. So let us summarize retinitis pigmentosa. So it is usually a person of 60 years old male, or it can even be female. They usually present to the ophthalmic OPD, or it can even be younger patient. So why? So in what scenario will it be a younger patient, or in what scenario will it be an older patient? So patient who are having sporadic mutation will be older, and patients who have genetic mutation are usually younger. Genetic mutation are of three types. It can be autosomal dominant, autosomal recessive, and the X-linked recessive variety, where the autosomal recessive is the most common variety, whereas X-linked recessive is the least common. But thankfully, because it is the most severe variety and most visual threatening variety as well. So a case of retinitis pigmentosa is usually 60-year-old male or female. I mean to say it is a particularly old age people, or it can be a younger age person if there is a genetic mutation which is inherited in the either it can be autosomal dominant recessive or X-linked recessive pattern. They usually present with chief complaint of diminution of vision, so decreased vision. And if you keep on asking them, you'll find that they will say they have decreased vision, especially at night. So they will complain of nyctalopia. There will not be any ocular finding like of xerophthalmia, so it will be absent. So probably vitamin A deficiency is not present. So vitamin A deficiency is not the cause behind nyctalopia in these patients. And when you do photo stress test, you will find that they have decreased or they have delayed dark adaptation time, where the adaptation time is more than 50 seconds. So this will be found. So there is a patient who is complaining of decreased vision and is having tunnel vision or tubular vision. He's complaining with nyctalopia, and he's also having a delayed dark adaptation time. You Then you will perform fundus examination, and upon examination you'll find a triad where you will see a consecutive optic atrophy because you are seeing a pale and waxy optic disc. You will see the attenuation of arteries, and you will see bony spicules or pigment dispersion. So this is a triad, typical triad that is seen in patient with retinitis pigmentosa. And now you'll perform investigations, and upon doing perimetry you'll find out that there is a pericentric scotoma, or also called as ring scotoma. Note that you will also hear this term ring scotoma in patient with glaucomatous optic atrophy, but it is not the case here because you have to correlate with other findings as well. So there will be ring scotoma, and upon doing electroretinogram, what you'll find is that there will be a flattened ERG with decreased amplitude of A wave and decreased amplitude of B wave. If you find a patient who is having all these findings, but these findings are not in the pattern that I've described, then it is considered to be atypical retinitis pigmentosa. There are four varieties of atypical retinitis pigmentosa. One of them is cyan pigmento. In cyan pigmento variety, there is absence of bony spicules. So bony spicule is absent. The next variety is retinitis pigmentosa albicans, where the bony spicules is of white in color. The next variety is retinitis pigmentosa sectoria, so also called as sectoral retinitis pigmentosa, where the entire retina is not involved, particularly a sector of the retina is being involved. The next variety is retinitis pigmentosa inversus. So inverse retinitis pigmentosa, where the central vision is usually hampered initially and the peripheral vision is hampered at the end. There are several ocular findings of retinitis pigmentosa. So different ocular findings include either the eyeball will be large, like myopia, the the curvature of the cornea is changed. Keratoconus is the next finding. There can be open angle glaucoma. There can be posterior subcapsular cataract, and there can be cystoid macular edema. So, if a patient of retinitis pigmentosa, typical retinitis pigmentosa, is complaining of decreased central vision, then probably you have to search for cystoid macular edema. It might be one of the important findings. So, ocular findings must be remembered. It is associated with different syndromes like Lawrence Moon Bidal syndrome. So, where you will see obesity, polydactyly, hyposmia, and other features. It is associated, the most common syndromic association is Usher syndrome, where you will find retinitis pigmentosa along with deafness. There are other syndromes like Kearns-Sayre syndrome and Refusion syndrome and other syndrome. There are thousands of syndrome which are associated with retinitis pigmentosa. Sadly, the treatment is not available, but placebo like vitamin A can be given. Vitamin E can also be tried. Docosahexaenoic acid can be given. And the ultimate treatment is transplantation of the eye, or there is implantation of a bionic eye. It can also be tried, but we cannot stop the progression of we cannot stop the disease entirely, but we can delay the progression of disease. Thank you very much. This is all about retinitis pigmentosa.